Ebola explained, "Imagine a disease so deadly that entire communities become fearful when a single case is reported. That disease is Ebola. Ebola virus disease, commonly known as Ebola, is a severe and often fatal illness caused by viruses belonging to the Ebola virus genus. The disease was first discovered in 1976 during simultaneous outbreaks in Sudan and what is now the Democratic Republic of the Congo. The virus was named after the Ebola River, located near one of the first outbreak sites. Scientists believe that fruit bats are the natural hosts of the Ebola virus. The virus can spread from infected animals such as bats, monkeys, chimpanzees, and antelopes to humans through contact with blood, body fluids, or tissues. Once a human becomes infected, the virus can rapidly spread from person to person. One notable outbreak was the Bundibugyo Ebola outbreak, caused by the Bundibugyo strain of the virus. This strain was first identified in 2007 in the Bundibugyo district of Uganda, although it had a lower fatality rate than some other Ebola strains. It still caused significant illness and loss of life. The discovery of this strain highlighted the diversity of Ebola viruses and the ongoing threat they pose on recent weeks. Countries have evacuated their citizens from Congo, including the US, which planned on moving them to Kenya, a major non-NATO ally, for quarantine.
Democratic Republic of the Congo is if a patient is sick. Again, I'll speak as a heart doctor. I want to take the patient to the OR that's right next door to the room they're sick in, not to the building next to them, or to 3 buildings 2 blocks away, because that time is precious to us. You have a golden hour in many of these instances around trauma, but for illnesses, it's also relatively short. So we are confident, and the State Department's working on this diligently, that they're going to be able to work out something with Kenya. There has already been a fair amount of communication around this issue. We have and that's about it. There's a UK base there. We have other people who might be willing to welcome us, and we have our German colleagues as well. So there's many places we can send folks, but sending them across the world, especially when we're not sure what's going on with them, is probably not the wisest move.
This sparked countrywide protests against the move, with citizens citing a possible outbreak
built by the U.S. military for Americans exposed to or infected with the virus. On Tuesday, a Kenyan court blocked the field hospital for another 3 weeks and ordered the government to disclose its agreement with Washington.
They said this is an institution or it's a quarantine facility for only the Americans. And we have to tell Americans to get off our noses business.
The 50-bed unit has faced pushback over concerns about cross-border infection.
This caused a clash between citizens and the government.
Between the government of Kenya and the American government is for the good of our country.
Ruto says it's one of 24 centers that had been established in the event of an Ebola outbreak.
Ebola virus disease develops in several stages. The first stage is the incubation period, which lasts between 2 and 21 days after exposure to the virus. During this time, the infected person does not experience any symptoms and is not contagious. Most people begin showing symptoms about 8 to 10 days after becoming infected. The disease usually starts suddenly with early symptoms that resemble common illnesses such as the flu, malaria, or typhoid. These symptoms include a high fever, severe headache, fatigue, muscle and joint pain, sore throat, and loss of appetite. Because these symptoms are not unique to Ebola, the disease can be difficult to identify in its early stages. As the infection progresses, patients often enter the gastrointestinal stage. Severe vomiting and watery diarrhea become common, accompanied by stomach pain and cramps. The loss of large amounts of fluid can lead to dehydration and rapid weight loss, making the patient's condition much more serious. In the severe systemic stage, the virus begins affecting multiple organs throughout the body. Patients may experience difficulty breathing, chest pain, confusion, and extreme weakness. The liver and kidneys can start to fail, and blood pressure may drop dangerously low, leading to shock. Some patients then develop the hemorrhagic stage. Although severe bleeding does not occur in every case, those affected may experience bleeding from the gums, nose, or digestive tract, resulting in blood appearing in vomit or stool. Internal bleeding and easy bruising can also occur as the virus damages blood vessels and interferes with the body's ability to clot blood properly. The final stage is the outcome stage, which can result in either recovery or death. Patients who survive gradually improve as their immune system gains control of the virus. However, recovery can take weeks or even months, and survivors may continue to experience fatigue. In fatal cases, the disease can lead to multiple organ failure, joint pain, eye problems, and difficulties with memory or concentration, severe shock, and uncontrollable bleeding, with death typically occurring between 6 and 16 days after symptoms first. Today, vaccines and improved treatment methods have significantly increased survival rates. However, Ebola remains a serious public health threat, especially in regions where outbreaks occur. Understanding how the virus spreads and how to prevent infection is essential for protecting communities and saving lives. Ebola serves as a reminder of the importance of disease surveillance, medical preparedness, and international cooperation in combating infectious diseases around the world.